Immunization Information System with Pre-Vaccination Screening for the patient to counter vaccine hesitancy in the Philippines.
Chapter 1. The problem and its background. The World Health Organization defined vaccination as one of the most effective ways in order to prevent diseases. It helps assist the immune system in order to fight pathogens which causes diseases. The Department of Health defined vaccine hesitancy as the delay or refusal of vaccines despite the vaccination availability. It is also said that vaccine hesitation is one of the threats to global health. The researchers will figure out the causes of this problem and also possible solutions in order to counter them. Conceptual and theoretical framework. Paradigm of the study. Statement of the problem. The main purpose of this paper is to determine the causes of vaccine hesitancy in the country, to know how it affects the society, and to provide solution to the problem. It will specifically try to answer the causes of vaccine hesitancy in the Philippines. How does the vaccine hesitancy in the Philippines affect the society? What are the different perspectives regarding the vaccine hesitancy in the Philippines? What solution can be proposed with regards to the vaccine hesitancy in the Philippines? Hypothesis. Null hypothesis. There is no effect between the vaccine hesitancy in the Philippines and its society. Alternative hypothesis. There is an effect between the vaccine hesitancy in the Philippines and its society. Scope and limitation. The research will cover the whole Philippine society but will only limit the study to STEM students of Senior High Department of Far Eastern University, Alabang, specifically the section of SK02, as part of the said society. Significance of the study. The study will benefit the following: STEM students, health allied or medicine professionals, health sector in the Philippines, and other researchers who will conduct the same study. Definition of terms.
Chapter 2. Review of related literature and studies. This chapter contains the different studies and literatures related to our research. According to a narrative review named Countering Vaccine Hesitancy Through Immunization Information Systems, technology tools plays important role to IIS. Because IIS are integrated systems which the process of vaccination is recorded. It provides accurate data to make informed vaccination decisions and protect against vaccine-preventable diseases. Also stated in some literature that this could fight and eliminate vaccine hesitancy. In terms of privacy, IIS must protect privacy of all users and gives notifications, choices, use of IIS information, access to disclosure, and data retention.
Pre-vaccination screening involves medical staff such as nurse, doctor, and health professional asking the patient a series of questions. It is a procedure that should be given to the patients before they take a vaccination. This procedure makes sure that the vaccine that the patients are going to take is safe. The medical staff should ensure that they will vaccinate the right person with the right age. They also need to check the correct time interval since the person received previous vaccines or blood procedures.
Chapter 3. Methodology. This chapter will present the methods that will be used in the study. It will also describe the subject of the study, the instruments, the procedure of the data gathering, and the statistical treatment of the data. This research will determine the causes, effects, and perspective of STEM students from grade 11 regarding the healthcare system in the Philippines, vaccine hesitancy by conducting a survey on a specific section of pupils in the Senior High School Department of Far Eastern University, Alabang. Research design. The researchers will use mixed methods of qualitative and quantitative researches, allow a combination of numerical measurement and in-depth exploration. Descriptive research design is a type of research design wherein researchers are solely interested in describing the situation or case under their research study. Source of data. The researchers will make use of an online survey questionnaire. The survey questionnaire consists of 2 questions about the respondent's profile and 6 questions regarding the causes, effects, and perspective of the grade 11 students of SKO2 of the Farm Eastern University, Alabang. Data gathering procedure. The researchers will make an online survey questionnaire through Google Forms. A survey will be made by the researchers and will let their selected respondents answer the survey questionnaires through online promptly and honestly. And Google Forms will then collect the responses right after they have finished answering.
Chapter 4. This chapter includes the presentation, analysis, and interpretation of the data gathered. The results of the survey conducted by the researchers are presented in charts and tables. This study aims to determine the causes of the vaccine hesitancy in the Philippines, to know how the said existing problem affects the society, and to provide possible solutions to the issue. Graph 1. Age of the respondents. The chart shows that the majority of the respondents were 17 years of age, with 25 respondents. 17 of the respondents were 16 years of age, while only one of the respondents was 15 years of age. The number of respondents were a total of 43, with age ranging from 15 to 17. Graph 2. Percentage of people agreeing and disagreeing about the presence of vaccine hesitancy in the country. Graph 3. Possible causes of vaccine hesitancy. Graph 4. Percentage of people who thinks that vaccine hesitancy has an effect on the community. Graph 5. Possible effects of vaccine hesitancy in the country. Graph 6. Percentage of STEM students who thinks that vaccines are safe for everyone nowadays. Graph 7. Willingness of teenagers to take vaccines from school-based immunization program.
Chapter 5. Summary of findings, conclusion, and recommendations. The purpose of this research was to propose a solution to an existing problem in the Philippines related to health allied or medicine, which was vaccine hesitancy. To accomplish the solution, it became necessary to reach some prerequisite goals. The researchers used survey questionnaire as their fundamental instrument in determining the society's perceptions. The survey was conducted in grade 11 students of the Science, Technology, Engineering, and Mathematics strand section of SK02. After undertaking the research, the researchers have come up with the following conclusions. The causes of vaccine hesitancy in the Philippines are the recent issue about Tengvaxia as the main reason why the people tend to lose their trust in vaccines. Insufficient information about the vaccines, concern of the parents, personal beliefs of people about health, and personal concerns and lack of public knowledge about vaccines. The highest possible effect of vaccine hesitancy in the country could be the future generation will be at risk and the inability to protect the people of the community from various diseases. Other effects could be deadly diseases that have been prevented before. It might return, an outbreak of various infectious disease may occur. The proposed solution is the pre-vaccination screening for the vaccine and the patient as part of the immunization information system to counter vaccine hesitancy. Recommendations. Based on the research, the following further related studies can be undertaken. Effects of pre-vaccination screening for the vaccine and the patient as part of the immunization information system in the Philippine society. How health professionals impact the decision-making of Filipinos regarding vaccination and how the Philippine society perceive pre-vaccination screening for the vaccine and the patient as part of the immunization information system in the Philippines.